So welcome to this next session, which is on suprarenal gland. Okay, adrenal is the other name because it is adjacent to the kidney. We feel there are these two suprarenal glands and they are one and the same. It is not like that. There is slight difference in their shape. The right suprarenal is triangular, and the left suprarenal is slightly, kind of as a semilunar shape. Semilunar shape. As we discussed when we talked about the kidney, there are layers which of fascia which cover the kidney, and superiorly they unite with each other, and again they split to enclose the suprarenal. Now let us talk about the relations of the suprarenal gland. As we said, the right suprarenal is triangular, and it is related to two structures on the anterior side. It is IVC and liver. We know the bare area of the liver on the posterior surface is related to suprarenal. So anterior relation of the suprarenal with liver, and in that bare area there is IVC. It will be related to IVC. Now the anterior relations of the left suprarenal, and these are kind of the structures forming the stomach bed, because it itself forms the stomach bed. So this huge area will be related to stomach, and this on the top apex will be related to spleen, and then here lower down it is related to the pancreas. Okay, and in between this is the splenic artery. So anterior relations of the right suprarenal quite easy, IVC and liver, and anterior relation of the left suprarenal spleen, stomach, splenic artery, and pancreas. Now let us talk. These are the four diagrams. So let us talk about the posterior relations. Posterior relations are same for both the right and the left. Posteriorly related to only two structures, and that is the diaphragm and the kidney. So in the right side, this area is related to kidney. The base will be always related to the kidney, and this area is related to diaphragm. Okay. Now consider the left kidney. So this area will be related, the left suprarenal, this will be related to the kidney, and this part will be related to diaphragm. Okay. So anterior relation of the right will be IVC liver, posteriorly will be kidney diaphragm. Anterior relations of the left kidney will be spleen, stomach, pancreas, splenic artery, posteriorly will be kidney and diaphragm. Now the most interesting part about the suprarenals is that the suprarenals are endocrine glands, and for that reasons they are very rich in nerve supply, and therefore it is supplied by three arteries. So suppose this is the aorta. Aorta gives the renal artery. Okay, and that goes to the kidney, and here is the suprarenal. And aorta gives its first branches as inferior phrenic arteries. From this inferior phrenic artery, this is inferior phrenic artery. From this inferior phrenic artery comes the superior suprarenal artery. Superior suprarenal artery. From the aorta comes the middle suprarenal artery. From the renal artery comes the inferior suprarenal artery. Okay, same on the other side. Okay, there will be middle coming from aorta, superior coming from inferior phrenic, and the inferior suprarenal coming from the renal vein. But there is a difference in the venous drainage. Suppose this now is IVC. The right suprarenal drains into IVC, but the left suprarenal, instead of draining into IVC, it it drains into the renal vein. This is also true for the gonadal vein. This is also true for the gonadal vein. And here now comes the one of the reasons, like suppose in case of male, this will be testicular vein, and this secretes epinephrine, non-epinephrine, and this epinephrine, non-epinephrine slightly causes contraction of this renal veins, and because of which this they may go renal veins may this no, epinephrine, non-epinephrine can cause slight constriction of the gonadal vein also, because of which the pressure of on the left testis is more, and therefore the varicosity or the varicocele, okay, varicocele of the left testis is more common because of continuous epinephrine, non-epinephrine coming out of the left suprarenal vein, which slightly affects the left testicular vein. Okay, the development of the suprarenal, you need to know that it has a cortex and it has a medulla. The cortex, it develops from mesoderm, while the medulla, which secretes epinephrine, non-epinephrine, it develops from the neural crest cells. There, histologically, all of us know that in the cortex, there is zona glomerulosa, then there is zona fasciculata, and then there is cells going like this, zona reticularis. And then there are the cells in the medulla. And there is difference in the cells of medulla and cortex, and that main difference is the cells in the medulla store the hormone in the form of granules, while the cortex, they produce the hormones as per need. Okay, as per need. And therefore whenever external steroids, you know, this zona fasciculata secretes corticosteroids, glomerulosa secretes aldosterone, this secretes the sex hormones. So the corticosteroids, whenever they are given externally, the internal corticosteroid secretion stops. So always the dose has to be tapered whenever we stop the external corticosteroid administration. So, and it has to be slowly tapered so that the internal secretion can start again. Otherwise, if we give high doses of corticosteroids to the patient, the internal corticosteroid secretion is stopped. And if we stop the external corticosteroid tablets immediately without tapering the dose slowly, there will be no corticosteroid in the patient's body, and this can be fatal. Okay. Applied anatomy of this congenital anomalies, there may be some change in the position. More common or most important is one tumor here, pheochromocytoma. You know, where excess epinephrine, non-epinephrine is secreted, which increases the blood pressure, it increases the heart rate also. Okay, so that's about the suprarenal gland, and I stop here. And exactly at 9 a.m., Dr. Sham Kishore sir, he will be taking the lecture. So please join back again.